So, the first topic I want to talk about is, so COVID relief has just gone out, which is awesome for many people. Lots of people are going to be getting a check, $1,400 check, which was supposed to be a $2,000 check. Never mind. Okay. Should have been a $2,000 check. Really should have been $2,000 recurring checks. The pandemic isn't ending tomorrow, right? People are going to need continual aid. But the part of this I actually want to talk about, well, there's a lot of COVID-19 stuff I want to talk about, but the first thing I want to talk about is COVID-19 vaccines. So at this point, we just got news from the Biden administration. All Americans are supposed to be eligible for these vaccines starting May 1st, which is amazing. The sooner we can all get vaccinated, the sooner we can get back to normal. Biden was even talking about maybe having a normal July 4th. That would be amazing. I would really love to see my family sit around the barbecue and all that, and even maybe have some friends over, which is a crazy thing to say because we've been living at home for, a year now. But there's an issue with these vaccines, and I don't mean this in an anti-vaxxer sentiment or anything like that, so if you have that nonsense, there's the door. These vaccines are being primarily held in rich countries. So I don't know if you know this, but the United Nations created this initiative called COVAX. It is a multi-member initiative to ensure the fair distribution of COVID-19 vaccines to the world. And at this point, it hasn't had much success because the rich nations, so think European nations, the United States, China, Russia, Israel, Saudi Arabia, and some of the Gulf states, have been buying up all of the vaccines before poorer countries in Africa and South America and Central Asia can buy them. And because there's only so many of these vaccines, and I'll get to why that is in a second, we are reinforcing this kind of neocolonialist. We're reinforcing kind of this neocolonialist narrative of rich countries versus poor countries, and that richness and poorness, it's not natural. It's artificial. It was created by colonialism, right? So we live in this strange world where, in theory, like, colonialism's over and everyone can compete on the world stage equally. It just isn't true, and the COVID-19 vaccine is proving that's the case. And one of the reasons, by the way, that there are so few vaccines to get around, even though it seems like there are lots of vaccines, there really aren't compared to the world population, is because these vaccines are patented technologies. And these companies want to make a buck off of these vaccines, which it just tells you everything you need to know about capitalism. I mean, these vaccines are going to be essentially the only way that we get back to normal. And I don't just mean us in the United States, I mean our brothers and sisters all around the world. There's only one, brothers, sisters, and non-binaries all around the world. And if we aren't careful, we're going to end up in a world where some people are essentially from rich enough countries that they can do what they want to do, and some countries are going to be locked in this kind of never-ending cycle of disease that they can't control because there aren't enough vaccines, or they'll get it so late that they will be further hampered in their ability to transact in the world economy and things like that. And that really is an unacceptable state of affairs. And to go back to the patent point, first of all, we shouldn't have these patents at all. The United States government and the governments of many other countries funded these vaccines. They put the money into the universities that allowed for these vaccines to be created. So what happens is, a professor or whatever looks, does the research at a university, and then once all the research is done, a pharmaceutical company comes in and buys the rights to it, pays the researchers a bunch of money for it, and then they own it, and they can mass produce it. A lot of the times, now in this case it was a little different, because it wasn't done at the university level, the money was provided directly by the federal government. But oftentimes what happens is that public money is used to develop these, then private capital swoops in, buys the rights, and then sells it for a profit, claiming that the high price for these is because of their R&D costs, when really, who paid the R&D cost? You did. I did. The American people did. The people of other countries did. Through our tax dollars. This should be free. Completely free. To us, to our brothers, sisters, and non-binaries in other countries, there's no reason why we should ever have to worry about being in a world where a majority of people outside of a few nations cannot get a vaccine because of the greed of a few corporate CEOs who are essentially controlling whether or not you get a vaccine in a different country because it costs them too much money, or it doesn't pay them enough profit to do that. And that kind of behavior, that pure greed, that greed at the expense of people's lives. I mean, COVID-19 is a killer. Like, let's not forget how many people died in the United States. Like 500,000 dead in America alone. And if your profits are worth more than their lives, you're a trash person. You're just not, a good person at all. You just can't be. To that end, by the way, COVID-19 is not the only pandemic we're going to have. There are concerns in the public health community that a pandemic like this isn't going to be like once in 100 years, it could be once in 20 years. We just don't know when the next one's coming or what it's going to be. There are concerns that there will be more pandemics, and so we get back into this cycle. So what's the solution? Honestly, I believe the solution is to completely nationalize every industry related to health. We're talking from ambulance rides to pharmaceuticals and everything in between. We should guarantee in America, and honestly, most nations already do this to some extent, that just by living here, you get health care. You get the medicines you need. There should not be a profit motive tied to people's health. If you can hold over someone's life, just hold over someone their ability to live or die because they can and can't pay something, I mean, that's monstrous. Human lives are supposed to be the most important thing, right? So, and by the way, in the United States, at least, our tax dollars fund other things that have to do with life. Police, fire, right? So, there's a reason we don't pay private fire insurance anymore, because it has to do with saving our lives. There's a reason we don't pay for private police departments, and although I think there are lots of issues with the police, there's a reason that we don't allow for private police forces typically. So the medical field is just an extension of that. It's our ability as a nation to say, this is something that we care about. This is something we prioritize. We want the people of these United States, and by the way, many other countries have already done this, to not have to worry, to not go bankrupt from being stuck in a rut where they don't have enough money to pay their medical bills. And by the way, no one controls when they get sick, right? Look, in some cases, if you took a risk and you're harmed by that risk, okay, I can understand in some very, very limited situations why you might say, well, they should pay for their mistakes, and not all of us should pay for their mistakes. For the most part, you don't control when you get sick. A lot of times, you don't even control when you get hurt, right? People sprain their ankles walking down the stairs. You're not doing anything dangerous, right, that way. People are walking in the street and they catch a cold. It's in the air, right? People aren't controlling when they get sick. So to treat it as if, to punish people for getting sick, as if it's their fault for some reason, or breaking an ankle or something, as if it's their fault, is totally ludicrous. And we shouldn't do it. We shouldn't do it. We need Medicare for all, and we need a total nationalization of healthcare in America. One last point on this, actually, because I actually worked in bankruptcy for a little bit, and the primary reason that people came to me and the organization I was working for concerning bankruptcy was always medical bills. Well, not always, but it was almost always medical bills. People were having to give away their life savings, and they couldn't afford it, and the only way they could get out was bankruptcy. Is that the country we want to live in, where people have to go bankrupt because they got sick, bankrupt because they grew old, bankrupt because they made a mistake and they got hurt, or they stepped on the stairs wrong? Is that the world we want to live in? Really? Really? That's not the world I want to live in. And I think most Americans agree. In fact, I know most Americans agree. Medicare for all polls at 71% in some polls. It is overwhelmingly wanted. We need it, and we need it now.